All right. So, Dr. Ball, how long have you worked with adults on the spectrum, and what prompted your interest in working with this population?
So I've been working with individuals on the spectrum for most of my career, probably about 15, a little over 15 years, but I really started working with adults in 2009 when I started graduate school. So my graduate mentor, Catherine Lord, had a longitudinal study, and she has followed a cohort of individuals since they were about 2 or 3. And at the time I started school, they were kind of transitioning to adulthood, so around 18, give or take a few years. And so that was really the first chance I had to work with some older individuals. And I was just really struck in, the range of strengths and accomplishments and goals that the adults themselves shared with us, and that the people supporting them, their caregivers, their family members, also shared. And that really piqued my interest. And I wanted to do more to better understand how we could support those individuals in achieving their goals as adults.
And so the title of the talk today is Autistic Adults and COVID-19. So I wanted to talk a little bit about your study that was recently published. And so just curious, what sparked you to do this study on COVID-19? And then how has COVID-19 affected autistic adults based on the study?
Sure. So, well, when the pandemic hit and everything shut down, I think all of us obviously were taken off guard and realizing how individually we and our families were affected. And as a psychologist who works with adults on the spectrum, I think knowing that individuals who were really struggling because they lost their sense of security, their daily routines, everything was disrupted for everyone, but certainly for those people who we had contact with, recognizing very quickly how sort of uncharted territory we were in. And so I've been at Rutgers now for just 3 years. And so we have a relatively small group of adults that we've seen through our research and clinical programs. And, I wanted to also reach out kind of more broadly beyond the sort of local community to understand how people were doing. So I reached out to some colleagues at Spark and asked, what are you guys doing? Just knowing that it's a big nationwide study. And they were, of course, already putting together surveys and getting ready to get the first survey out. So I had the opportunity to collaborate just because they were already getting ready to collect the data. I provided a tiny bit of input, but really they had already assembled a bunch of questions to send out to the larger Spark sample. So, but I felt like it was really important that we knew that autistic individuals, both children and adults, would be affected, and that we needed to raise awareness about that. So everyone was feeling so out of sorts, for lack of a better word. And I think I didn't want to see autistic people lost in that, and assumed that, early on, we heard some people assume that maybe autistic adults wouldn't be very affected because of stereotypes that they didn't want social contact with people anyway, or that they tended to stay home more. And maybe that's the case for some individuals, but we knew again that people really were suffering from a great deal of distress. And so wanting to use data to be able to document that and raise awareness and hopefully underscore the need for supports. So in terms of the study, like I said, Spark had already put together a survey. We had a team of people that provided some input. They sent that out to over 3,000 adults that were enrolled in the Spark database. I think there was responses by a little over 600 in the first survey that was sent pretty early on in the pandemic. So the very end of March, early April. And then they sent a follow-up survey at the end of May, and sort of it was open until early June. And I think the response rate there, of the 630 or so that responded the first time, almost 400 responded to the second time. And so that was the data set that we had to use. And I was personally really interested in understanding the psychological impact of the pandemic. So really looking at the different areas in which people felt their lives were negatively impacted, and then also their psychological distress across those 2 time points early in the pandemic. And so you asked about findings. In terms of the main findings, I think first off, again, this was very early in the pandemic. So the first survey being just at the end of March, and already at that point, the majority of autistic adults were experiencing disruptions in their lives. And a very high proportion, a little less than half, reported a moderate to severe level of psychological distress. And that's important if you contextualize that in general population samples that use sort of comparable surveys. Only about 10 or 11% of the general population was reporting similar levels of distress at that point. So that's a huge difference. We don't know, we don't have previous data to know whether, we would expect that many autistic adults might have been experiencing high levels of distress before the pandemic. So we would expect maybe more people to have that. So we don't know if that's a persistence or if it's a reaction specifically to the pandemic. But we did find that distress from time 1 to time 2 in the sample was associated with increases in negative impact. So more areas of their life that were negatively impacted, and decreases in the amount of hope that they were experiencing about being hopeful for the future. So we do think that that's, and there's obviously something related to the pandemic happening there. And so the comparison to the general population is really, I think is quite profound, that many individuals with autism were experiencing such high levels of psychological distress is something that we really want to pay more attention to and make sure that we have services and supports developed, obviously as the pandemic has persisted, but I think really pointing also to, as we start to transition out of the pandemic, hopefully, what is that going to look like for this group of adults, and how are we going to be able to support them through a time that's uncertain for everyone, but where that uncertainty might be particularly profound for this population of people.
Okay, so you went over the main findings, and maybe there's some overlap here, but what would you say is most surprising or significant about this research?
So I think the role of hope was really the most sort of interesting part of the study that I found. I don't know if it was surprising so much as I thought it was important that we were going beyond like, look, everything is bad, and here are the reasons why things are bad. I think that many people felt like the findings were not so surprising, right? That many areas have been impacted, and the more areas you had impacted in your life, the more distressed you felt. But I think the finding that decreases in hope across those early months was associated with higher stress or distress at time 2, but also that hope really seemed to make a difference for those people. If you compared people who had a high level of impact in multiple areas of their life, and some people reported sort of minimal or mild distress, and some people reported more severe distress, hope was a factor that differentiated those 2 groups. And so trying to, identify, hope really. So identify ways that we might, more positive ways that we might help to support people, right? We can't necessarily very easily mitigate we can't make jobs reappear in the middle of a pandemic. And it's hard to, certainly we could do better supporting people in employment and in schools and things, but it's hard to change some of those circumstances. And so finding other ways to support people, I think is important.
Mm-hmm. All right, so the study's published, you have these findings. Where do you go from here? Will you be doing more research using this type of data, or more surveys through Spark?
That's a great question. So Spark has continued to send out surveys. I'm not 100% sure. I know that I think the data has been released for up to the third wave. So we published on the first two, and I believe it's been sent out a fourth time, or certainly there's plans to continue to send this out. So that data is there. I don't have specific plans. I think if there's time, I would love to think about looking at that. People want to collaborate, that would be wonderful. But I guess in my particular lab and our clinic, we've pivoted a bit more to kind of thinking about what can we do. And as I said, thinking about supporting people now who are already experiencing distress, but I am really concerned about what's going to happen as things start to open up again, and as there continues to be uncertainty about, the different variants that are out there and the effectiveness of vaccines, and people are still struggling to get vaccines, and there's still a lot of unknowns, even though things are looking sort of better. And so finding ways to support adults now. So we've been doing some work developing new programs or new interventions, or adapting existing interventions to help support mental health specifically. So emotion regulation, as well as depression and anxiety.
Okay. Actually, related to that, the next question is, if someone were looking for services related to mental health, where should they look? Do you have any resources that you recommend?
Yeah, so honestly, that's a really hard question in a place like the US, where the resources vary so much, state to state, county to county, city to city. I will say that, first off, the Autism Asperger's Network, AANE, has a lot of online and free resources and events. And so those aren't necessarily specifically mental health treatments, but there's support groups and things that people can do to meet other people and engage in social activities in a safe way. So I think that's a great resource for people to check out and see. There's many things for adults as well as for family members and children, I believe. So I think if you're looking for clinical supports, there's a few practical things you can do. So Autism Speaks, I think Autism Society of America, and lots of local agencies have online sort of databases where you can plug in something like your age, you're looking as an adult or for an adolescent, and specific areas like mental health, or maybe even as specific as I'm looking for a psychologist, and you can sort of search regionally. So I think those are good places to try to identify more specifics. If you really are experiencing psychological distress, I would hope that you can find a mental health provider. Those can go by lots of different professions, but especially psychologists and social workers, or psychiatrists maybe. You can certainly, I would encourage people to reach out to their autism centers if they have one that's sort of local or even kind of in their state. Even if that particular center doesn't offer specifically what they're looking for, often they have lists of resources that they can refer people to that are more local. And I think the other thing I would say is, I don't think it's always the case that you need an autism expert to provide mental health supports. I think in many cases it can certainly be helpful, but I think it's on individual providers to really decide, whether that's within their competency area. So if you are an expert in, excuse me, like cognitive behavioral therapy for treating depression, and you've been doing CBT for depression for decades, then it strikes me that if you're working with an adult for whom CBT is going to be a good fit in terms of treating depression, then you may be able to consult with someone about autism if that's not an area that you know much about. And frankly, the client themselves might be able to educate you a bit. I think we have to be a little careful about how much burden we place on our clients in terms of educating, but in a similar way to how we as providers think about cultural competencies. I think autism, knowing about autism and understanding the specific needs of an autistic individual, knowing a little bit about autism only gets you so far. You also have to know the person who's sitting across from you. And so I think for people who are looking for providers, a lot of people are going to be limited by their insurance companies. And so looking through your provider list of approved psychologists or therapists and seeing who's there and not being afraid to pick up the phone and say, this is what I'm looking for. Do you think that you can provide that for me? And a lot of local providers also will have their own referral lists so that if they can't take a specific client, they might have other ideas about resources as well.
Thanks, that was really helpful. So related to this in some way, did you find anything about remote therapy in your research, and if that was working in the early days?
Yeah, so we didn't have a lot of detail about online services in the Spark study, but what we did find was that early on, about 2/3 were accessing online services. So that would suggest that many providers pivoted pretty quickly. What we don't know is exactly what those services were. So they might have been mental health. A lot of the participants in the study had reported seeing a mental health provider in the months before COVID. So that's a definite possibility, but it could have been any range of online services. Within that sort of 2/3, about 3/4 of people who are receiving online services said they had moderate to significant benefit from those services. So I think that's a good sign. Unfortunately, I guess the online services in and of themselves at time one didn't necessarily predict later levels of psychological distress. We might have liked to see, yes, being enrolled in online services, mitigated distress at time two. We didn't find that, but there's lots of reasons, like I said, we don't know what those online services were. They might have had nothing to do with mental health. But we did find, interestingly, that within the people who were receiving online services, that the participants' perceived benefit of those services did actually predict later distress. And so I think that really pointed to a need to understand the nuances of what is a negative impact to someone's services, right? So is pivoting to online mitigating sort of the perception that okay, my services are impacted, or is being online just fine? And then in the context of online services or telehealth, what is helpful and what isn't helpful? And so to really understand what was sort of factoring into that perceived benefit, I think that's probably going to be a more individualized sort of, depends on what kind of therapy it is, depends on the characteristics of the individual person. But if we could identify, ways to estimate whether we think an online service is going to be helpful for someone, that would be, I think that's an important thing to think about, especially, online services could have the potential to increase accessibility for supports beyond the pandemic, right? It happens that we really are relying on them now, but we could be reaching people in more rural communities or people who don't have transportation. So I think this is a really important area for us to spend some more time thinking about, irrespective of COVID.
Mm-hmm. So you work at the Center for Adult Autism Services at Rutgers.
Mm-hmm.
Can you just tell us a little bit about that and what you found successful, and then if there are other programs that you know of that are similar?
Sure. So the Rutgers Center for Adult Autism Services, or RCAAS, is sort of an umbrella for 3 programs right now. So the first program is the SCALE program, which is supporting community access through leisure and employment. We're a big fan of acronyms. So that's a community and employment support program. So it's very small. It admits maybe 4 to 6 individuals per year, and it serves adults with autism across the range of abilities. So some individuals who have minimal language and significant cognitive impairments, and some individuals who have college degrees, and they all need varying levels of support in their employment. And so the job helps to identify employment opportunities and support them, as well as other kinds of community engagement. So navigating community resources and socializing and those sorts of things. The college support program is within RCAS, and that's a program for Rutgers undergraduates who are on the spectrum, and that provides primarily academic supports. And then the Psychological Services Clinic, which is the clinic that I direct, focuses on assessment and mental health services primarily. And so we provide some services to adults in both of the other programs, as well as to adults in the community. In terms of other centers like this, so to my knowledge, RCS is sort of unique in the kind of breadth of different populations that it serves within the autism spectrum. I think there are certainly there are many different kinds of employment programs, there are many different college support programs, there are many different more kind of mental health service programs. And I think, the scale program strikes me as maybe kind of the most unique in that it's very situated within the university community, very individualized supports, and is not time limited. So people who enroll in that program can stay with that program as long as they want or need supports. So, I think there are unique aspects, and maybe altogether identifying as one group and aimed at supporting autistic adults across the range of abilities is sort of unique, but I think the programs within each of those are represented in different ways across the country, across the world.
Okay, thank you. So I'm going to pose a question that we got in the chat. I don't know if you'll be able to answer it, but let's see. So someone is asking if day habilitation in the home can offer the same benefits of social interaction in a center for adults who prefer to stay home.
Sure. I think that's a great question. I don't know that we know a lot about necessarily the benefits or how services compare in different settings, right? I think that's a very individualized sort of focus in terms of if someone prefers to be at home, then it strikes me that putting them in a center is not going to make them very happy, right? And so it makes sense that we would want to support them in the place where they're most comfortable and where that makes the most sense. I think it's very important to take into account personal preferences, and that we shouldn't be forcing people necessarily to, go out and socialize with a big group of people if that's not what they want to do. I think that in particular for adults, one of the wonderful things about being an adult is you have the autonomy to make decisions, right? So when you're a kid, you have to go to school, you have to do certain things. But as adults, we all have different preferences, especially socially. And so, there are certainly different domains, of course, I think of adult life that we may need to push people more. So, it may be that for, working, it might be harder to find an at-home job. And so, exploring possibilities of jobs outside the home, in which case, supports in those different settings might be important. But I think that certainly there should be a balance in it. And depending on what the day habilitation is also, I think there's a good argument for supporting someone where they need to be supported.
Great. Okay. We have just a few minutes left here. If anyone else has questions, please put them in the Q&A box. I'll pull another one from our list here. So we talked a lot about people that already have an autism diagnosis. And one of our more popular webinars that we've done in the past was done with you on the topic of adult diagnoses. So if someone were seeking an autism diagnosis in adulthood, where should they look, or do you have any recommendations?
Yeah, so I'll be honest, it's tough. There are not a lot of places that specialize in or offer autism assessments specifically for adults. So unfortunately, a lot of our sort of big autism centers are situated in pediatric departments. So if you are a young adult, often, they're allowed to see sort of transition age adults, up to, I don't know, 25 or 21. It varies depending on the department, but I think I certainly would, if there is an autism center that's accessible to you, often these are sort of embedded within universities, that's a great place to start. Again, even if they don't provide that specific service, hopefully they would be able to point you in the right direction of local providers that may be able to offer that. I think that for most conditions, adults get referred to psychiatry departments that may or may not have that expertise, but I think it's worth trying to contact them. And I guess I have a bit of hope that maybe if departments receive lots of referrals for certain questions and they don't have the resources currently to support those individuals, that maybe that would be a red flag for maybe we need to recruit some resources or expertise here so we could offer that service in the future. And then again, I think the resources that I mentioned earlier, sort of the online databases that you can put in kind of what you're looking for and where you live might help to point you to some resources. So I think many of both the ASA and the Autism Speaks ones, at least, you can put in, you're looking for diagnosis, you're looking for the sort of adult age range and see what comes up. I know in New Jersey, Autism New Jersey is a local organization for the state that has a great resource list of all the providers in New Jersey that offer these different kinds of things. But I know a lot of, people who contact our center are looking for resources. And so, we know a little bit locally, there's not a lot. And so I think partly it's, I would still encourage people to contact their local psychiatry or community mental health or whatever it might be, because I think if there continues to be an increasing demand, then maybe somehow we can use that to encourage our departments to do more training in those areas and to expand the availability of providers who are able to offer those services.
All right, just maybe one more here. Someone is asking about the age range that was included in the study. So do you happen to remember that? Specifically, they want to know if there were adults over 40 in the study.
Yeah, so the survey included 18 to, I want to say 70 or 75 years of age. And actually I have it here, almost a little over a third, so 35.6% were over the age of 40.
Okay. All right. So if they wanted to kind of make some inferences about that group, they might be able to dig into the paper a bit more.
Yeah. Maybe I'm not sure that I can tell you that there wasn't a lot of findings with respect to the oldest group, but again, the data is there, and so you can certainly apply to Spark too if someone wanted to dig into more sort of questions specifically about that older group as well. Okay.
All right, well, we're at 2. That flew by. Thank you so much. This was really, really helpful. We've got through a bunch of questions here. This was recorded, and so it'll be on YouTube and on our website in the next few days.